4th February is World Cancer Day, and we all know that each one of us has this capability of making a difference. We all, you all, and everybody, whoever it may be, can contribute or put in their effort to make this world cancer free. Cancer is not 100% preventable, but yes, the incidence, the mortality, morbidity can be reduced to a great extent. Knowledge has power, and we know that prevention is better than cure. Female cancers, as we know, are the breast cancer and the cervical cancer. Breast cancer in India, the incidence is almost 25 women per lakh of women, and 12 of them per lakh tend to die from this dreaded disease. And 1 woman in every 59 women is likely to have carcinoma cervix. So the WHO aims at reducing the incidence of malignancy in women. They want to reduce this rate of 25 women per lakh to as low as 4 women per lakh by the year 2030. Now, breast cancer, if you think about prevention, then there's a new term that is coming up, that is self-breast awareness. That is self-examination of the breast. Every woman above 35 years of age, or anybody who have had a history of carcinoma breast in their family, they should at least examine their breast, if not every month, every 2 to 3 months, or at least 3 to 5 examination per year. And the best time to do is day 2 to day 7 of the menstrual cycle, or if it's a menopausal woman, she can do it any time of the month. We advise you to inspect your breast in front of the mirror. They should examine and look for the level of any dimpling, any lump, indiscrepancy in the size or the level of the nipple, and then do a palpation, that is by touching by means of your fingers. The best time to do it is while you're taking a bath. You can use soap, that will make palpation easy. And we advise you not to poke your fingers or pinch. The breast tissue is very soft and spongy. If you pinch it, then you're likely to feel it as a lump. So first thing is to palpate a normal breast. And if you find anything abnormal, that is, if you find a lump which is hard, and how do you know it's a hard lump? It feels like bone. Touch your bone, this is hard. Your earlobe is soft, your nose is a little firm, the cartilage. So it has to be a hard lump. And this hard lump, if it is painless, then it's a cause of concern. Painful lumps are in fact good. Any lump which is increasing in size rapidly, again, is a cause of concern. Any nipple discharge, any lump which was mobile but now has become fixed to the skin above or tissues below, is again a cause of concern. So first thing is examination. You have to be very vigilant, and if there is any discrepancy, if there is any doubt, go consult your doctor. They can get an ultrasound or a mammogram. And any lump which is less than 2 centimeters in size can be detected by these investigations. And less than 2 centimeters, stage 1. And the earlier the problems are diagnosed, the better the treatment is complete and the prognosis is better. And after self-examination, another thing I would like to talk about is cervical cancer. And cervical cancer, uterine cancer, if you think of the uterus, It has two types of cancers. One is the uterine cancer, which is mostly it is the carcinoma endometrium, cancer of the lining of the uterus. This presents with bleeding, so the patient gets a warning sign, and such patients, they come to doctor very early. The second type of cancer is the carcinoma of the cervix, of the lower part of the uterus. This is mostly because of human papillomavirus. Human papillomavirus is a virus which has been implicated in causing cervical cancers. Any abnormal bleeding, intermenstrual bleeding, contact bleeding, or any foul smelling, dirty, copious discharge should not be ignored. In fact, we suggest that for prevention of these cervical cancers, women, they should consult their doctors whenever they go for any sort of checkup. They can get a pap smear test done. Pap smear test, it's a test in which all the shed cells from the genital tract are collected and they are examined under the microscope to look for any changes or any suspicion in these cells. In fact, if there are any abnormality in the pap smear, one can also undergo a colposcopic checkup, which is a test in which the cervix is examined under magnification, and we look for any precancerous changes in the cervix or any suspicious lesions, which can be biopsied directly. And another thing that I would like to emphasize here, that a vaccine is available against this HPV, human papillomavirus, which is implicated in causing carcinoma cervix. They are bivalent and quadrivalent vaccines. In certain countries, they are given